The Aurum Institute is a proudly African organization whose mission is to generate evidence to policy and policy to practice. Aurum is a global leader in the field of TB and TB-HIV integration and COVID-19. Established in 1998 in South Africa, Aurum has grown to include operations in Mozambique, Ghana, Lesotho, and Eswatini, with a staff presence in the USA and Europe. We have conducted more than 180 research studies and clinical trials at 4 main clinical research centers, focusing on TB and latent TB treatment and TB vaccines. Our work includes the following multi-country projects. The Impact for TB project, increasing market and public health outcomes through scaling up affordable access models of short-course preventative therapy for TB. This flagship project prioritizes short-course TB preventative therapy, or TPT, for people living with HIV and children under 5, and subsequently all those in close contact with TB patients in 12 high-burden countries, who represent 50% of the global TB burden. It is led by Aurum in Mozambique, South Africa, and Ghana. CUT TB, community and universal testing for TB among contacts, evaluates new models for TB contact tracing and will provide important economic, microbiological, and pediatric insights into TB contact tracing in Tanzania, South Africa, and Lesotho. Opt for TPT, optimizing the delivery cascade for tuberculosis preventative treatment among people living with HIV, aims to generate critical knowledge to improve TB preventative treatment uptake, implementation, and outcomes in Ethiopia, Zimbabwe, and South Africa. Ascent, Adherence Support Coalition to End TB, supports TB patients with their treatment in an innovative and more effective way through the use of digital adherence technologies such as smart pillboxes, medication sleeves, and video-supported treatment in South Africa. TB Sequel aims to advance the understanding of the clinical, microbiological, environmental, and host immune factors affecting the long-term sequelae of pulmonary TB. Its objectives are also to determine occurrence of reversible and irreversible costs and socio-economic consequences for TB patients and healthcare systems, and to facilitate novel interventions to restore and preserve overall health, well-being, and financial protection in patients with TB in Mozambique, Tanzania, South Africa, and the Gambia. The DRTB HDT project, Stratified Host-Directed Therapy for Drug-Resistant Tuberculosis, will determine if 2 adjunctive host-directed therapies can prevent the poor outcomes of treatment in cases of rifampicin resistance. Patients with rifampicin resistance and other risk factors for poor outcome will participate in a randomized, controlled, 3-armed multi-center trial in Georgia, Romania, Moldova, Mozambique, and South Africa. The Aurum Institute, creating a healthier world for future generations.